Today, we are going through the skeletal system and homeostasis, so please make sure you are at the right spot on your homeostasis chart, because nothing stinks worse than realizing halfway through that you're not in the right place. Okay, so the first system we're going to look at here is how the skeletal system interacts with the integumentary system. So the skeletal system helps provide structural support for the integumentary system. With the nervous system, the skeletal system actually helps to provide calcium for the neuron synapse, because remember, there's a lot of calcium minerals in our bone tissue. So when we mobilize that calcium, a lot of it actually, well, some of it actually gets used at the synapse in the neurons. And it also obviously helps protect things like the brain and the spinal cord. There are receptors that are also embedded at the joints that provide positioning information, specifically those proprioceptors that help us determine our 3D orientation in space. With the muscular system, there is calcium that gets provided for contraction. Remember, that's what gets released from the sarcoplasmic reticulum that moves away that troponin and tropomyosin off of the active sites on the actins, so that the actin and myosin filament sliding can take place. They also act as levers for movement that the muscles actually pull on. With the endocrine system, the skeletal system helps to protect the endocrine organs in your chest, in your brain, and also in the pelvic cavity. So there's some protection functions that are there. With the cardiovascular system, obviously there's calcium that is needed for cardiac contraction, because the heart is a muscle just like any other muscle. And it also helps to produce blood cells that provide our blood volume within the marrow. So red bone marrow obviously is, the site of red blood cell production. And then probably most importantly, the heart and the largest blood vessels, so the aorta, the superior and inferior vena cava, those are protected by the skeletal system. With the lymphatic system, the bone marrow helps to make and also store immune cells so that we have them. With the respiratory system, obviously the thoracic cage, the rib cage, protects those lungs. And the movement of ribs are actually very important in breathing. Just so you guys know, the joint for the ribs is actually not in the front. It's actually at the back. The ribs actually kind of rock. So if you kind of put your hands together flat, okay, and then you kind of curve them. If you rock them together at the heel, that's kind of, that's how the rib cage is actually partially able to expand. It actually kind of pulls out like that when you breathe. With the digestive system, there is some protection that's provided for your digestive organs between your pelvis and even your spine. With your urinary system, again, it's going to protect almost all of your urinary system. So your kidneys, your ureters, and your urinary bladder are provided some protection by that pelvis. And lastly, with the reproductive system, it fully protects the female organs, and it helps to partially protect the male organs and glands of reproduction. And that is it.